So thank you for coming to our Finding and Accessing Public Datasets session. My name is Samantha Walsh. I'm a librarian at the Levy Library at the Icahn School of Medicine at Mount Sinai. And today we are going to go over kind of thinking about your data need before searching, locating data and statistics that is publicly available. So that is what we're going to try to kind of focus on today, publicly available data, and citing data. So your data need. So thinking about your data need, I want you to kind of step back and think about your focus. And so what is it that you're looking for? So for example, if you are interested in anxiety and depression in New York City, you might kind of need to think specifically about time periods and kind of like why data from a certain time period may or may not be relevant. For example, if you're conducting this research in about 10 years from now, you might want to like avoid data from 2020 because it would be, very skewed because of, what might be going on in the world at this time. So it's important to kind of think about your focus and what it is that you're looking for. You also want to think about potential sources. So how was the data collected? So when you're thinking about potential data that you're looking for and where you might find it, you want to step back and think, well, how would this data even kind of be possible to obtain? Is it data that most of the time would need to be collected in healthcare provider's office or institution? Is it data that would most likely be collected in schools or on a census, something like that? So stepping back and thinking about data collection and how that might even be feasible for what it is you're hoping to find will help you potentially get to what you're looking for. And then finally, it is kind of important to make this distinction between data versus statistics. To be honest, we are going to today when we look at our demo, we are going to kind of blur that line a little bit, but it's important to remember that data is raw information collected, via a study, via, something like a census, whereas statistics is a summary and sometimes analysis of data. So very often you will find just statistics and then need to potentially request the data that those statistics are based off of, or you might be lucky enough to find both. And so again, when it comes to kind of thinking about your need, you might kind of realize like, oh, I thought I wanted data, but I'm actually interested in statistics about, a certain population or something like that. So types of data and data sources. And so I guess I should probably call this types of data and statistics and data and statistics sources. So when we're thinking about types of health data, so of course there are, so many types of data, in the world. There's like market data, there's, like I said, census data. So of course, we are thinking specifically about health data right now. And certain types of health data include vital statistics. So that is statistics about births, deaths, marriages, stuff like that. Health behaviors and risks are, potentially self-reported behaviors and risks that could be collected via surveys, stuff like that, reports about diseases and conditions, and then data about the healthcare field overall, and finally, data on populations and communities. So again, when we're thinking about, typically when we're thinking about a specific data need, for example, anxiety, anxiety in New York City, that potentially combines two types of data, data about a specific population or community and data about a specific, I guess we can call it a condition. And so we need to kind of think like, okay, where am I starting here in terms of my data need? And that's what can kind of bring us into thinking about types of data sources, which is basically like, I like to say like, when we're thinking like, who cares? Who is collecting this data? And so we're going to kind of focus on specific types of data sources today. But when we're thinking kind of broadly, we might have government data sources, NGO data sources, institutional. So, the Icahn School of Medicine at Mount Sinai does have a data warehouse, research data that's published hopefully sometimes alongside research studies. And there are, of course, for-profit companies and organizations that collect data as well. Are they always making that data publicly available? Probably not, but it is out there. So, finding data. So I do want to kind of step back and kind of talk about two specific resources that I'm not talking about today, which is paid resources available through the Levy Library and the Icahn School of Medicine data warehouse. So the Levy Library subscribes to a ton of databases, ebooks, everything that we hope that you need for your research. And with that, it does include a data index. So I do want to kind of just show that, even though we won't be using it today. So if I'm on the Levy Library's homepage, and I scroll down to under Browse Collections Databases, so there's two things I could do here. I do really like our subject dropdown here. So where I click all subjects, and then I have statistics right here. And so there are some really useful resources here, including some that are actually totally freely available, specifically NYC data. But I actually recommend not using this filter and just typing the word data. And what I want to point out is the data citation index. So this is a database of bibliographic articles that have data attached to them, or independently published data sets. And so what you can do is you can search there. We're not going to search this today, but this is definitely when I kind of describe the few different things that I recommend doing when you're starting to search for data. I definitely recommend searching here as well, because this is a great way to see what research data sets are available. I also want to point out, because I'm sure it's something that's occurred to a bunch of people, the Mount Sinai Data Warehouse. So that is maintained by Research IT, and that can be accessed by contacting them. There's a few different ways. I know that there's a self-service query tool that there's some online trainings for, and there is a paid option where you can have them query it for you. But that is not the focus of this session. What we're going to try to talk today about is publicly available data, and kind of what does that mean? Because most of the time, even though we find data referenced online, and it might even technically be freely available, that doesn't necessarily mean that we can click a button and find it. But we are going to kind of talk about data that is freely available. So beginning your search. So the kind of, if I was going to kind of just, create a guide about publicly available data or freely available data, it would really just be a big list of places to go. And there are so many organizations, government organizations, non-government organizations, that you can go to locate data. And so I don't want this session to be just kind of like a big list. So I want to kind of start with tips and tricks for how I would go about locating data when I don't know what the, where the best place to go is, where I'm not sure where the most the most relevant data for my question is. And so the first thing I would do is actually start searching the published literature. I would start thinking about I would start trying to see okay, other people are most likely using data to write research articles about this same topic as me. What data are they using? And so that's sometimes all you have to do, and you find something great. I also want to step back and think okay, what are the organizations or potentially the big national or multinational studies that are collecting this data? And sometimes it's immediately oh, of course, the CDC, but sometimes it might be, a specific disease. And I want to kind of see okay, is there a specific organization kind of devoted to this disease or condition? And I can kind of see if they do any kind of data collection or if they have any kind of coalition around this. And then finally, the last thing I want to talk about is data repositories or indexes. So technically what I did just show you, the data citation index, that is a data index, and that's a great place to search, but I am going to point out a few freely available ones as well, because data, as I think, all of these bullet points is making clear, data collection is extremely decentralized. It's kind of all over the place. And so it's really interesting and exciting that these repositories and indexes are trying to bring it together a little bit. Of course, it's still difficult. So if I want to take okay, I kind of just went over all of this. And so before I go into kind of discussing kind of a specific question, I do want to kind of just talk about, like the heavy hitters, because, 9 times out of 10, these places are where you're going to go for your data need. So we want to think about going to the World Health Organization, the United Nations collects health data, and then kind of like the big one is the US Department of Health and Human Services. So I think we always think like, oh, okay, CDC, the CDC data. The CDC is technically part of the Department of Health and Human Services, and so there are some really great resources. If you go directly to the Health and Human Services website, you can find a really useful list of basically all of the data collected by that department and kind of all of their, kind of like sub-departments, which includes the CDC. And then when we're thinking a little bit more locally, we're very lucky to have useful data provided by New York State and New York City. So let's say I am wondering, I would like to see kind of like what data is available on obesity rates among New York City adolescents. And so of course, and this is something I say when it comes to a literature search, just as much as a search for data, what I'm willing to do basically to get this data and maybe how long I'm willing to wait, if I need to request this data, if I need to fill out some kind of application, all of that is, kind of depends on my data need, right? Why do I need this data and when do I need it for? If I need it for a quick presentation that I'm putting together that I'm giving in 2 days, I probably can't be filling out an application. However, if this is for a larger research project, then I absolutely should consider all of the data available and, potentially fill out an application for whatever it is I want to find. So thinking about obesity rates among New York City adolescents, like I said, my first step would be kind of searching the literature that already exists. I would want to go to Pubmed, maybe Google Scholar or Web of Science or Scopus, but this is healthcare, so Pubmed works just pretty well. So I want to kind of just do a quick search. This is by no means some, like perfect search. And I'll see like, okay, can I find any articles that are reporting on obesity in New York City adolescents, and I can see maybe what kinds of data they use. Typically, when I do a search like this, I'll actually add a line that says something like dataset or survey or, data or something like that to try to capture specifically articles that we're using data sets. But because I was including New York City here, I decided not to do that. So you kind of have to think like, okay, for example, let's say I got no results for this. I would have to say like, okay, I kind of have to give up the New York City thing here and see what else I can find. And then, of course, because I'm looking for data, because I'm looking for recent data, I want to, limit it to the last 5 years. One thing I want to point out before I find a potentially relevant result is you may have noticed in the new PubMed, we have this new filter, associated data. So this is brand new, and what they're trying to do for us is make it easy for us to get to papers where, along with the I guess I'll call it manuscript, along with the published manuscript, the authors have also provided publicly available data. So typically that is their research data. And so this is a new filter. I would say it's a little bit imperfect at this stage, but it's really exciting, and it's definitely something to think about as an author as well, that it's a pretty cool feature that if you publish your data along with your paper, you'll be able to kind of have it show up when people click and only want papers with associated data. So that's definitely something to use and to think about in the future if you're looking specifically for like research data. So let's say I'm going to see kind of like what might be relevant for my paper here or whatever I'm looking for. So obviously in these times I have to scroll through some COVID stuff, and then I see, okay, childhood obesity and food environment, a population-based sample of public school children. So I'm like, okay, population-based sample, that could be useful. And then I see really big number here, and I'm like, okay, they must have some data. And so if I click through to the article, to the article's abstract, I see height and weight data from the 2009-2013 annual fitnessgram assessment of New York City public school students. Awesome, that's exciting. What's fitnessgram? I want it. So that's what I'm thinking at this stage. But what happens so often is exactly what happens with this paper. When I click through to the paper, so now here I am, and what I'm hoping and thinking is that the paper will, cite fitnessgram directly, whatever it is that fitnessgram is. And so I'm going to go to the methods section, and I see height and weight data came from the 2009-2013 fitnessgram, an annual school-based standardized assessment that measures BMI of every public school child in kindergarten through 12th grade. Like, wow, couldn't be more perfect for me, right? And it looks like they cited it right here. And in the interest of time, I will explain what happens. All they really did is cite another paper that used fitnessgram. And they cited another paper that used fitnessgram through, even a different year. This happens all the time. And it's pretty common. They're not actually citing the data, which begins to indicate to me that this data might not be super publicly available. So maybe I do have to kind of table that, or maybe I have to think like, okay, if I want this data, I need to start contacting the New York City Department of Education. So maybe I'm like, okay, I want to step back and ask my question again. Who cares? Who cares about this data? So we know the Department of Education cares because we found what they do, but maybe the New York City Department of Health is also kind of doing something as well. And so if I go to the New York City Department of Health data website and, click data here, and then I can kind of link through to their tool called EpiQuery, which is, it's really useful, but this is where I'll kind of say we begin to kind of get our difference between data and statistics, and what we start to get is statistics instead of data. So if I click through to EpiQuery, there's a lot that you can do here. There's a lot you can browse. However, I've on many occasions have much better success just searching for whatever it is I'm looking for. And then clicking through and finding whatever it is I'm looking for, which in this case, I'm now seeing. And so it's going to take a minute to load, but it is it is data based on the New York City Youth Behavior Risk Survey. And so this is when I want to kind of step back and think, okay, what is this based on? Because this other kind of non-starter that I found earlier sounded really interesting. It's data collection taken throughout the year by a physical education teacher or school nurse. So I can kind of think like, okay, they probably got most public school children. How are they getting this data? And so what I want to look for is information about the survey. And so it's, this usually involves kind of like reading the small print, but that's what I can kind of begin to find when I take those steps. And so I want to point out that there is a kind of a different way. So if I go back to the City Health, and so if we take a look at data sets specifically, and and we click through to the youth risk behavior survey, now that I know that that's actually what I'm interested in, which I found through EpiQuery, I can get myself to kind of what is more kind of reliable straight data as opposed to statistics. And so there's kind of, this is very, you know, when looking at the CDC's website and the New York City Health data website, you'll typically find the same data presented a few different ways. They'll try to kind of create visualizations for you. And then if you click through enough, you can typically get to the data more specifically. And so that's typically what you want to do if this is something that you actually want to use for your own analysis. So what if I wanted to kind of say like, okay, well, what if there was, you know, I don't like that this data is, you know, just from 2017, or I don't like that this data is only on public school children. So I want to see kind of like what else is out there. Maybe there are hospital-based studies, maybe there are specific organizations, and that is where data repositories and indexes might help us. So I want to introduce a really useful tool, which I actually meant to link on my slides and I forgot, and I'm sorry. So it is the Registry of Research Data Repositories. So what we would actually be searching here is repositories and organizations that collect data. So it's kind of like 2 or 3 levels beyond the data itself. But it's a really great way, and you know, obesity is kind of such an obvious topic, but if there is kind of a topic that we're new to or something that we're just really not sure who is doing this research, this is a really great way to kind of figure out where things are happening. And this is an international repository of repositories, or an international registry that is currently funded by an organization from Germany. So it's not US specific at all, which I think is really useful, because usually in these situations where we're confused and we're not sure what we should be looking for, you know, it usually is because we're kind of like going beyond the United States or New York City or something like that. So if I search obesity, and sorry, everyone had to look at my recent searches there, what I'll begin to find, so actually what I wanted to do was first kind of show like what happens if I search obesity New York City in here, and it's nothing, because again, remember, this is not a search engine where we're looking specifically for data. It's really kind of this overarching, like, what are the organizations, what are the who's kind of collecting this data. And you know, we do get what a study is a result, but again, it's a collaborative study. And so what we're getting is kind of, again, these overarching institutions that might help us find something. And so the last kind of useful thing I want to point out is the data discovery collaboration. So this is really, really exciting to me. And what this is this is basically a collaboration of libraries and organizations, for the most part in healthcare, that basically have, you know, noticed this issue where healthcare data specifically is extremely decentralized, and most of the, you know, with the exception of, you know, this government CDC data, is very, you know, very difficult to find, and typically kind of like behind these applications. And so what they aim to do is make their own data, their own institutional data, available for discovery, not necessarily immediate, you know, reading or consumption, but available for discovery, along with other data sets that might be, or other data kind of like places that might be useful to their patrons or others who want to search. So if I'm kind of thinking back to my specific data need here, I see NYU has a data catalog I can search, and Hofstra and Northwell have a data catalog I can search. So I'm thinking, okay, they're both in New York City, and so they might both have something of interest to me. And so I'll go with Hofstra Northwell. No, I guess Hofstra is technically not in New York City. And so let's see if I search obesity. And what is the first thing I find? So this is really, really useful. And this is why it's so exciting that these organizations are doing this, because now I have potentially more information about that first data set that I became aware of. And so it is clear that I need to kind of, in some capacity, contact the New York City Department of Education for this data set. But now, instead of just having the New York City data available to me, depending on what I'm using this data for, I have something else as an option as well. And so I want everyone to kind of keep those data catalogs in mind, because again, these are a lot of what I'm kind of showing you is like new, including like the Pubmed filter. These are new ways for kind of data discovery that are only going to continue to grow, which in my opinion is pretty exciting. So if we come back to our slides. So evaluating data. So of course, just like when we are evaluating a study that we might find, or including a book or a review in something that we're presenting, we want to evaluate the data as well, especially if we're planning to use this data for our analysis. We want to think about how the data was collected. Was it kind of collected by surveys? Was it collected in one specific healthcare institution? And what does that mean? And so a lot of that is really important. If this is something that you're going to be citing and using and analyzing, it's very important to describe that in your presentation or in your manuscript. Who collected the data and why? All of the institutions or types of organizations that I mentioned earlier are not created equal, and it's important to kind of remember why they collected this data. For example, I was recently looking into kind of the origins of BMI, the BMI calculation, and what it was based on. And I'm initially finding like, oh, it was based on, like large scale population data from the United States. However, the United States and the UK, sorry. However, when you actually started to look into it, it turned out that this population data that the entire BMI calculation was validated upon actually came from life insurance application surveys conducted by the life insurance companies from the late 1800s through the 1950s. So then when we kind of start to think about what this might be based on and why this data was collected, it gets extremely complicated. And so it's really important to kind of like read the fine print in those cases. And so of course, then that gets us to thinking like, okay, well, what attempts were made to kind of have a comprehensive view of whatever population we were looking into. Finally, citing data. So there's a few things that are really important to keep in mind. The dataset's preferred citation style and information. And so really ignore style there. The dataset's preferred citation information. So best case scenario is you will be looking at a dataset or data online and it will say, cite me this way. And what's really important to look at there is not necessarily the order that information's in or where the period is or anything, but the information. That is the information that this data set wants you to provide in order to create a citation. And then of course, your chosen or dictated by a journal, citation style, and then transparency. You might kind of create a citation. It's like, okay, I'm giving the information they want and I feel like I'm using my style, but does my reader really understand what I did? Does my reader really understand where this data came from? And can they get there themselves? So the most important thing to think about when creating your citation and also when describing the data that you used or that you're citing in your text, the most important thing to think about is, am I being transparent? Does my reader know where this came from and how I interpreted it? So citing data in AMA style, there are a few kind of points that they want to make sure you include. And for me, the most important one is the accessed date. Because of course, all of these, data might kind of continually change. And so, as we hope, as it's continually collected every few years. And so we want to make sure that our readers know like, okay, yes, there is 2020 data available, but I actually looked at this in 2020. That's why I'm citing the 2017 data. And so what you want to do is marry that with whatever it is that the that the organization wants you to cite. So for example, if we go back to that New York City data and we scroll down, it's usually like tiny on the bottom of the page, we see citation information, and they're telling us exactly how they want us to cite their data. And so what you want to do is kind of make sure that you combine that with however your citation style wants you to cite a data set, or sometimes they'll call it a database. So thank you all so much for attending. Before I take any questions, I want to just let everyone know that we have some exciting classes coming up through December. And we're also always available to meet one-on-one. You can visit this website to view upcoming sessions or request a consultation one-on-one with a librarian.